Broadcasting from the business capital of the world, this is the Podcast Business News Network. Ecstatic to be here with Dr. Gaddis. He's a licensed clinical psychologist and clinical neuropsychologist, and we have a lot to talk about. We're excited to speak with him. He's based out of Harrisonburg, Virginia, and he's been helping so many people, providing, clinical psychological care for everyone. So, first and foremost, welcome to the show. How are you today?
I'm fine, Jill. How are
Great.
you?
I'm doing well. Thank you so much. First and foremost, would you mind introducing yourself to our listeners, please?
Okay, well, I'm Dr. Audie Gaddis. Got my PhDs in clinical psychology and neuropsychology. Um, I currently, at this stage in my life, see people via telehealth. So I don't do as much of the neuropsychology as I used to when it came as it relates to doing testing and assessments. What I do is I've integrated that into what's called neuropsychotherapy. So people have an idea of what's going on with their brains when they're, especially if they're processing new information that often comes up in therapy sessions.
Thank you for that. And how can we reach you? Let's just share before we get to your background. And obviously, we're going to talk about that. And of course, the work that you're doing and the people you're able to help. How can we connect with you?
Well, my business phone number is 540-560-2501. I can be phoned and texted at that number. And then my email is Dr. Gaddis, DRGADDIS, all one word, at,
Mm-hmm.
and it's a complicated website name. So at my, M-Y, Psy, connect, all one word, mypsyconnect.com.
Perfect. And that's spelled mypsyconnect.com. Thank you so much for sharing
Right.
this. And I know you offer comprehensive psychological psychotherapy services online, as you mentioned, via telehealth. But I really would like to find a little bit more about you before we do begin. So, would you mind just sharing a little bit about your background, where you grew up, what brought you into this field? And we'll talk a little bit about your
Oh,
work and then the research and loneliness. There's a lot to get to.
yeah. What got me into this work? Wow. Um, I let's say I came from an interesting family that certainly prompted a need for psychological services.
God
Um,
bless. Mm-hmm.
and uh, but I always had this curiosity, even as a child, as to what makes people change,
Yeah.
why people change, what motivates people to change, why do we refuse change, even if it's in our best interest, why do we at times refuse it? And it was that compelling question which stayed with me through college and then grad school, and then my first PhD in clinical psychology, um, where I explored that. That didn't totally satisfy me. So I got involved in neuropsychology because I wanted to see what's specifically happening organically in the brain when uh, we're looking at that topic of change. And the reason why it's so important to me because psychotherapy, uh, which is thankfully much more popular these days, but that implies change. If we go on a diet, we're making a change. And sometimes knowing why we change, knowing how we change will help ensure a better outcome to what we're trying to achieve. And that's what got me. And I have lived in my practice has taken me all over the country. Uh, and I eventually settled in Harrisonburg, Virginia, which I have made it very clear to my family. This is where I'll be until the day I die. You'll have to drag me out. because I'm not leaving Harrisonburg. It's a small, rural Virginia town. And after living in Manhattan twice, after living in Washington, this is great. I just love where I live. Um, so that's really about me. I'm married. I have three children from a previous marriage. Um, three wonderful children. Um, uh, one of whom decided to go on and get his PhD in abstract algebra, which don't ever ask me to explain that. I don't have a clue what it is. Um, but he does very well with it. And my other children, they have their own careers that they're doing very well at.
Proud, very proud, Dad, as you should be. That's amazing. Well, thank you so much for sharing this. And, you also mentioned in your notes, which I want to talk a little bit about. You mentioned loneliness. Could you
Well,
share?
that, yeah, actually, I changed that. I keep researching and working on loneliness. Um, and in my research, I hit one of the main causes of it. And that's what I've been working on. And I've worked on it over 30 years, but it just, the correlation between loneliness and anxiety, um, especially social anxiety, but really any anxiety at all, is what's causing us to shut down and shut out our close friends and family. And it is a leading cause of suicide among seniors. A leading cause, not the leading cause. It is a major contributor to mental health or mental illness. If you're lonely, you're at a high risk for mental illness. If you're not lonely, you're at a high risk of living longer and staving off dementia. So it's amazing what socialization does and how it helps us better manage our anxiety, which gets in the way and causes us to be lonely. Um, and just, Jill, if you had to define anxiety, how would you define it?
Honestly, I feel like I know I have anxiety. How do I describe it? It's this feeling where, like, I'm feeling nervous right now thinking about it, right? I'm overwhelmed. I'm panicked. I'm worrying about the next thing that I don't have the time to do with two little kids, being a single mom, working full time. Anxiety is very high in my head. It runs in my family. I feel like I can never get everything done. And my mind keeps running like I'm a hamster on the wheel. If that helps, that's my anxiety. Do people describe it that way?
That's exactly how they describe it, that and more. I have experienced, I'll go ahead and admit it. In March, I will turn 67.
You don't look 67.
And okay, first of all, we were all born with some anxiety.
Mm-hmm.
It's what our brain uses to ensure the survival of our species.
Okay.
If we didn't have anxiety, and there's a part in our brain called the amygdala over here on the side. What that does is that's where you've probably heard about fight or flight.
Correct. Fight or flight
That
response. Yep. Mm-hmm.
that's where the fight, flight, or freeze response takes
Okay.
place. And that is the brain's warning system that we're in danger. If you can imagine, we're just hundreds of thousands or millions, however you want to call it, thousands or years ago. We're just coming down out of the trees or out of the caves, however you want to say it, or just got booted out of the garden. I don't know. But uh, suppose we don't have that function in our brain
Mm-hmm.
that tells us that we have to be cautious. We step out of our cave and we look at a saber-toothed tiger. Now, we know now you're not going to mess with that tiger.
Uh-huh.
That tiger, it would weigh at least 3 times as much as you if it was a
Uh-uh.
full
Uh-huh.
adult. It would see you, Jill, as a snack. Um,
Uh-huh.
and so not having that fear, we look at the tiger and we're here, kitty, 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 not realizing that we're constructing our own doom. Anxiety is what tells us, hey, there's something going on. It's excessive anxiety that is the problem. And that affects us. You described some great symptoms. Uncontrollable worry, it affects our concentration. We get very nervous. It increases our heart rate, sleep problems. We just don't enjoy life. We're tense. Our stomach's upset. And for me, I could relate to you talking about anxiety
Yeah.
because I can remember my first panic attack at age 4.
Oh,
And it sticks out to me because, well, when I was so young and just dealing with anxiety and going through life. And of course, my parents, I come from Appalachia. So my parents had no idea what was, what was going on, other than I was a nervous kid, is what they said. I was a nervous kid. Um, it has over the years, and I started seriously working on it once I got into college, and I have it at a manageable level. It never goes away, and I hate the feeling. I don't know how you feel about the feelings of anxiety. I hate the physical feelings.
me too.
Um, One of
Me
the
too.
things it causes is chest pain for me.
Uh,
Now, I've had 2 heart attacks.
uh,
And so my doctor, a visit last year, he was like, now, Audie, if you have any chest pain, be sure to go to the hospital.
uh-huh.
I looked at him and I said, are you kidding? I said, look at the chart. It says I have an anxiety disorder. That anxiety is what causes my chest pains. It's not heart attack chest pains. It causes chest pains. I said, if I go to the ER every time my chest hurts, I'll have to move in,
Yeah.
and the ER personnel will hate me for that.
Uh,
So it has physical manifestations. It's amazing what it does
well,
to our brains.
can I ask how you cope? Because I know you're not my doctor. Maybe you don't give medical advice, but I was told by my general doctor to try taking Lexapro, escitalopram, 20 milligrams. That does nothing. I'm still hyper and anxious. I don't know
Right.
what that's for. Maybe I got the wrong drug. I don't know.
Well, let's with those medications, the SSRIs, the SNRIs, such as Lexapro, they they work for a lot of people, but for a lot of people they don't.
Mm-hmm.
They don't do anything for me.
Same here. God
Right.
bless.
So what I've learned to do is I made necessary lifestyle changes. Um, I don't, well, I don't drink, but when I did drink, I didn't drink to excess.
Mm-hmm.
Um, I worked a lot on relaxation skills and meditation,
Okay.
which did more to save me than any of the others. I also
Wow.
did therapy, but I'll say
Yeah.
that between therapy sessions, it was the medication. I mean, it was the meditation that
Got it.
did because medication just doesn't do well with me. So I've worked. I have my clients. I tell them we're going to build an invisible toolkit that you're going to have attached to your side at all times. And there's going to be several things. There's going to be breath work. There's going to be imagery. There's
Yeah.
going to be progressive relaxation. There's going to be a
Mm-hmm.
number of things that we just want to lower it a little bit. If you rank anxiety like on a 0 to 10 scale, 10 being a panic attack, 0 being none, I
Okay.
hover around, I hover on an average day around 5 on that.
Yeah.
If you get six or
I can
seven, I'm
empathize.
intervening on myself.
Yeah.
I'm I'm doing things that will bring it back down. And that's all I want to do. I just want to bring it back down to a manageable level because we're going to have anxiety. It's controlling it, it's managing it. That
Mm-hmm.
is what has to happen. I've had people tell me that they have no anxiety at all.
Oh.
And I asked them the question, I said, one, either you're dead or you're fed.
You have a
Or you,
pulse? You breathing? Uh-huh.
and then the next question I asked, why are you afraid to tell me the truth? I said, everybody on the planet has some form of anxiety or another.
Yeah.
It varies in degree of severity.
Mm-hmm.
I don't know if you've experienced panic attacks.
Yeah, I've had a few. Again, I'm
Yeah,
not even sure if they were, but I'm assuming they were because I never sought professional help since I was a child because I'm even anxious and anxiety about, well, how am I going to find the time to talk to someone? How am I going to find the time to commit to someone? Who's going to watch my kids? How it gives me anxiety to think about the help that I need and how I'm going to get it. And in my head, I keep saying, I just need the kids away. I'm an amazing mother. I love my boys, but I'm with them
sure.
24/7. There's no every other weekend. There's none of that. So I'm always anxious. I can't get my chores done, my things done around the house. I'm always feeling so exhausted. I can't relax. I can't meditate. How am I going to add more time to my schedule to start talking to someone about my problems? Well, thank you for letting me share that. But yeah,
We're going to award you the poster child of anxiety for the week.
thank you.
And I do
Thank
that
you.
with my I do that with my clients. If a client is having exceptional anxiety, I'll tell them in a compassionate way, I'll say, well, you win. Win. I say, you're the poster child for anxiety this week. And I say, we have to work on this. All of
Hmm.
that, you can bring down the levels of all that. That's entirely possible. And reduce it to where it is not an ever present horrible feeling. I hate
Yeah.
the feeling of anxiety in my body.
Hmm.
Not only does it cause some chest pains and not heart attacks, what it does is I get nauseous, I get stomach cramps. I just can't stand the feelings of anxiety.
Yeah.
And and what I found, and this goes right into my research on loneliness, people experiencing anxiety do the obvious. The
Yeah.
obvious is they don't socialize, they isolate, they
Mm.
pull back. Now, me, I have social anxiety. That stems from having a panic attack in the middle of a grocery store years ago.
Wow.
I have a simple solution for that.
Hmm.
I
Oh.
only go to the grocery store with my wife. I don't go by myself.
Hmm.
I don't even want to risk a repeat of that. That was so embarrassing. Uh, so to avoid that, I just don't do it. Now that's an easy tip for me to do to follow to control my anxiety, but that's not always possible.
Yeah. Yeah.
I was almost panicking about this session today.
Wow. See, that's one thing. I do this for a living. I could talk to anyone and I enjoy it and I love meeting new people. A lot of times I get that fear from people. We talked before the show. Hey, I'm a little nervous. Hey, and I'm just like the first person to say, I'm like your friend. We're just going to have a conversation and I promise you you'll get through it and it'll be okay. So you're not the first to say that before the show, but I really
Oh
hope
yeah,
that you are having a good time because your knowledge is not only helping people listening, it's been helping me today. So I appreciate that. Thank you.
you're welcome. Here's one more reason why people need to manage their anxiety, and if they can't manage it on their own, that's why they should be contacting me. And that is, I have diagnosed literally thousands of people with dementia. You don't
Wow.
want dementia. You don't want it.
Uh,
And if you want to increase your risk for it,
mm-hmm.
don't do anything about your anxiety. Anxiety correlates with a higher risk of dementia.
Oh,
So
wow.
I tell people, get that under control now. Some of my most anxious people are in memory units for their dementia. Now they got dementia and they're having anxiety along with it. That is just, and so I tell people, get it under control before it's too late. And
And
that's why I work on it. I do the meditation. I do the progressive muscle relaxation. I do watch my diet. There's certain foods that make me more anxious than other foods. I I would love to drink.
hmm
I'll admit that.
yeah.
I love vodka.
Uh,
I could brush my teeth in vodka.
and I love
I
wine, since we're being honest. I have so many unopened bottles at my house. I don't know what to do with them because I don't have time to drink anymore. But thank you for sharing that. Yeah, but we,
I don't drink it because I know after I drink it, after it gets out of my system, I'm going to be twice as anxious as I was before.
and
And
not
I just
feel
don't
so
want that.
good.
Right.
Yeah.
I know I have a hangover, but I'll be very anxious about my hangover. I don't want
Oh,
that.
wow. Well, I mean, we are on a roll. We only have 3 minutes left in the show. I just can't believe how fast it goes. But this has been a great show. I hope we are having more shows, I hope, right?
Right.
All right, fantastic. Because I want people to know that you're here for them. So this is psychological care for everyone, and you're offering this now virtually. You know, is there a certain state you have to be in? Are you able to work? Where can you work?
Well, I'm licensed in Virginia, so I can only see people with insurance only in Virginia.
Okay.
I do have a way of seeing them outside of state. It's private pay, it's reduced, and they can contact me and we'll discuss that. I don't turn away clients.
Yeah.
It's one of my policies. I've got to a place in my life where I don't have to look to every client as, you know, uh, being able to feed my family. That's all resolved. And so now I can just enjoy what I'm doing.
And you're giving back.
And that's what I'm doing. And
Dr.
that's what,
Audie, that's amazing. That is
yeah,
so
I'm giving
I'm tearing
back.
up over this because that is beautiful that you're doing that for so many people. Really. Wow. I commend you on that. And as a great family man, as a doctor, as a companion, as you know, the man that I just met today on this podcast. And I hope everyone's been listening to this. And if not, you can obviously re-watch it, re-listen to it. And I hope maybe you put them up on your website. They can check it out. My ESYconnect.com. So mysyconnect.com to reach you. And do you want to share your phone number again?
MySideConnect.com.
Perfect. Do you want to share
Yes,
a phone number
540,
again as well? Go ahead.
yes, 540 560 2501.
Perfect. And how
Again,
did you want to leave
540
off?
560 2501. Right? Go
Yeah.
ahead. I'm sorry.
No, I know we're stepping on each other. It's just a little bit of a delay. No one's fault. How did you want to leave off to people out there who may be in need of your help?
Please contact me. We'll work something out. We can do it on telehealth. If that's impossible, we can do it over the phone. I see people in several countries.
Wow.
Uh, and it's it this is my passion in life, and I'm happy to do it. I don't know what else I would do.
Uh-huh.
I
Well, I could.
guess if I couldn't use my PhDs, I guess I would maybe greet people at Walmart. I don't know.
Me too. I like that idea, right? No job too unimportant doesn't go unnoticed. We all, I know I'm a happy
Right.
person like that too, and I love helping people. Clearly, you do, and it's amazing that. Thank you so much for being here and for
All right.
being amazing. Thank you again, Doctor. And Dr. Audie Gaddis will be back with us hopefully
Thank you.
soon, and we'll connect more. I would love to hear some stories, about some of your clients, obviously without using their name, but the type of things they're
Right.
going through and how you've gotten through to them and how you've helped change their lives for the better. Thank you again.
Okay.
All right,
You're
Doctor. Have a
welcome.
fantastic day.
Thank
This
you.
was great. Thank you so much. You made my
Thank you
day.
for your
I'm not
time.
alone.
Okay.
Listening to a professional tell me that it's okay to have anxiety because even the professional has anxiety. So it's thank you. Thank you.
You're
Thank you.
welcome.
Bye bye,
Now
darling.
you
Have a
can
great
relax
day.
a little bit about it. You take care. Bye bye.
You too. Bye bye.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.